Hey, everybody, welcome to Resiliency Radio, your go-to podcast for the most cutting-edge insights in integrative and functional medicine. I'm your host, Dr. Jill, and with each episode, we dive into the heart of healing and personal transformation. Join us as I interview medical experts, renowned thought leaders, biohackers, and people of all types and backgrounds, hopefully bringing you news to use and innovative ways to optimize your own health and performance. Today, I am so excited to bring back Dr. Paul Savage. I'll introduce him in a minute. He is the founder of MD Lifespan. You're going to hear all about why toxic load is increasing in evidence and a solution that you may not yet know about to decrease your toxic load, no matter who you are or what condition you're suffering from. So stay tuned for that. Before we do, as always, we have great quality um, products that have been curated by me at drjillhealth.com. I hope you'll pop in and visit, take a look if you need something for mast cell activation, Epstein-Barr, or just immune support. We've got all kinds of protocols and bundles and great products and services. You'll also find my Dr. Jill Beauty line, which is clean, effective, and anti-aging. It's the stuff I use myself. And one product I wanted to be sure and mention today is our retinol. It's called Advanced Bakuchiol 5X with, I'm sorry, Advanced Retinol 5X with Bakuchiol. This is a top seller. We run out frequently. It is so good because it's one of those things that creates the retinol anti-aging power, but with less likelihood of creating peeling and irritation. Years ago, when I used the plain old retinols, I would always get peeling, and in my state of Colorado, it was so dry. So I am loving this Advanced Retinol 5X with Bakuchiol. It is a powerhouse for anti-aging, probably one of my most powerful anti-aging products if you're over 40, which I am. I use this, and it won't create the drying that you're used to with retinol. So check it out at drjillhealth.com. Okay, let me introduce our guest, Dr. Paul Savage. He is a founder and chief medical officer of MD Lifespan and a leader in personalized medicine and toxin reduction. Through breakthrough innovations like the plasma exchange patented protocol, he empowers patients to take control of their health and promote longevity. He's a former ER physician who transformed his own health and dedicated to revolutionizing healthcare by addressing the global toxin crisis with cutting-edge science and patient-centered care. About MD Lifespan, which we're going to be talking about today. MD Lifespan is a specialized medical practice focusing on removing toxins and revolutionizing health optimization with the plasma exchange I mentioned. It is a patent-pending therapeutic plasma exchange protocol. You'll hear all about that today. And it's designed to address harmful environmental toxins, including microplastics, pesticides, PFAOs, and mold, my favorite topic. So join me as I interview Dr. Paul Savage. Dr. Savage, I love our conversations over the years, and today I'm so excited to have you on the podcast again because as I deal with environmental toxic load, which is my favorite topic to talk about, we talk both about this, there is an increasing evidence that this is overwhelming our systems. And one of the things I want to talk about today is MD Lifespan, what you've created, what you're doing, and how this could be a solution that really none of our detox protocols in the past have ever come close to. So
Yeah.
that's our frame today. So stay tuned, guys. You're going to learn
It's a
some
game
focused stuff.
changer. It's a game changer. Everybody stay tuned. You got
Yeah,
to live.
yeah, for sure. But let's go back to the basics. We were talking right before we started a little bit about this idea, and you've been in ER originally, and then you've created multiple companies. But do you want to take us on the journey of like kind of how this idea birthed itself, and then really the problem that we're dealing with toxic load in our environment?
Well, thanks, Jill. But, I was an ER doc for 10 years, and then I got sick. And I went to my doctor, and he was putting me on more medicine, and I got sicker. And that's when I started realizing I had to do something different. This is a very common story with everybody, but I did this in the 90s. And then I found this group of people, doctors that were doing functional medicine, personalized medicine, whatever you want to call it, which is just basically not throwing away Western medicine, using that, but adding into it other things, supplements, nutrients, but also looking at it in a different way, looking at what's causing all these problems, right? That's really what we're doing here is we're trying to figure out what's causing the problem and then get that cause out, where traditional medicine just treats symptoms with a pill. We're clear on that.
Yeah.
Over the course of my 30 years, and you're right, I've built many different companies we've done and serviced people in many different ways. But I've learned about the hormones, and I've learned about the gut and the microbiome, and I've learned about the stem cells, I've learned about the neuro, and I mean I've learned every system one by one in a different view. And over those 30 years, the one thing that remained constant was we kept seeing increasing amount of toxins in the environment. With that coming increasing inflammation. I can say that because I built the software system that measured all this for 30 years.
Yeah.
And we would literally watch toxins go up, inflammation go up, toxins go up. And so it was kind of whenever if you go to Chat GPT and ask, what is the cause of chronic inflammation? It will say, although the exact cause of chronic inflammation is not known, it has to do with lifestyle, nutrition, and environmental factors.
Yes.
Newsflash, spoiler alert, wrong. It's toxins.
Hmm.
I mean, that's an environmental factor, but it's all toxins. And that's what we've been seeing over the years. I got to the point where I actually retired and I was reading a paper about using plasma exchange that reversed the biomarkers of aging. And one of those biomarkers, the major biomarkers of aging, is inflammation and immune system
Yeah.
becoming weaker. And their conclusion was that plasma exchange, we'll get into that, um, was the purpose. What they did was they cleared out the excess of biology, of metabolism.
Yeah.
And I knew that the only way they could have those kind of changes is if they actually had removed the toxins. And that's exactly what plasma exchange does. So voila, from a person that was been using all sorts of detox methods for the last 30 years, including saunas and
Yeah.
chelators and binders and nutrition and every different ways you can do. And the problem is, as you know, it's getting harder and harder to treat people because people are getting more and more toxic. So the elephant in the room is very simply this. The United States is the second most toxic country in the world, and we're all sick and
Yeah.
we're all toxic.
Yeah.
Matter of fact, here's a news flash for people. Did you know the World Health Organization lists toxins as the number one cause of death above heart disease?
Wow.
24% of the world population dies from toxins now. And toxins are the cause of inflammation, which is the cause of heart disease, cancer, and neurodegenerative diseases like Alzheimer's. So toxins, the monster in the room.
Yeah, and we're seeing increasing evidence of the heart stuff, the autoimmunity, the neurodegenerative diseases, and many people, even physicians, are like, "What is going on?" You and I
Yep.
know the evidence is so clear. I think it's about 300,000 new chemicals are being introduced
Correct.
into the environment without proper testing, and then
Correct.
right, and air and water and food and all this is being contaminated. So
You
we no
know,
longer can avoid it, right? That would be the ideal.
years ago, you had mercury. I can tell you which fish to avoid. If
Right.
you had lead, I would tell you what water sources that you had to be careful of. Nowadays, every toxin's in everything.
Yes.
So, and it's so ambiguous, and there's so many everywhere that everybody's like, well, how do you stay safe? And the answer is, believe it or not, it made it simpler because you actually have to filter everything.
Hmm. And it actually, that's the beauty of this. It's non-selective in a way that's so
That's
beautiful because it takes all of the toxins out. And that's why
correct.
you've developed protocols, which we'll talk about for brain and for heart and for preconception and for mold, which is my
Mold, yeah,
excitement.
which is a
Yeah.
unique animal, always has been.
Right, right. So it's super exciting. Let's go back just briefly because this is not a new thing. This is not a edge fringe thing. It's been used in conventional medicine for decades. What did it used to be used for, and why is that mechanism of how this works
Sure.
effective for toxins?
So plasma exchange, or as it's called, therapeutic plasma exchange, is the idea that you take blood out, you separate it into the liquid part, which we call plasma, and the solid part we call cells, and you throw away the plasma, and then you put it with another solution and reintroduce it back in the body. It's an oil change. You're
Yeah.
giving the body an oil change. And but every time you do a plasma change, you're replacing a significant amount of your plasma. About 63% of your plasma, you're replacing with the replacement fluid. And within a day, your body makes brand new,
Mhm.
baby fresh, non-toxic, non-inflamed, non-oxidized, non-cancer plasma. It's just brand new plasma. So you make this plasma yourself. And then we just wait a while, about 4 weeks, and we do it again. So for those guys and the gals from my era, it's kind of like when we took the car and put it up on the stilts, and you drain the oil out, put new oil in the top, run it around the block for about 3 weeks, come back, and you kept draining the oil, draining the oil, draining the oil until it finally started running clear. That's exactly what we're doing. The plasma machine's been around for 50 years. It was first started out to be used against some some
Yeah.
a lot of the what we call immunopathies,
Mhm.
the Wallstrins, and where the body made too many antibodies against stuff. But pretty quickly, as it became more and more refined, we started realizing we could use it for a whole lot of stuff. Matter of fact, there's a phrase in medicine, it's called when in doubt, pharese it out. In
Mhm.
other words, just replace, if you don't know what it is, take it out, and replace it with else. So it's been used in over 167 disease states, but it's not primary for anything. That's why people don't know it very well. It's a third line therapy or fourth line therapy, mostly in the area of things that have to do with your antibodies, but it also has to do with things like long COVID, things that have to do with anything that demyelinates the neurons.
Mhm.
So like myasthenia gravis, Guillain-Barré disease, that's what it's been used for a great period of time. We've also known for a very long time that plasma exchange removes acute toxicities. So if we had somebody overdose on heroin, is what we used to in the ER, we used to use it to get the heroin out, or digitalis when we used to have
Mhm.
that. We can use it today that anything that's plasma bound, and everything is plasma bound,
Yeah.
that it can be removed when you remove the plasma. But nobody ever put together, and part of it is because traditional medicine doesn't understand the toxic world that everybody is living in and everybody is right now. We can use that to remove the toxins out of people, not just some of the toxins, Jill,
Mhm.
every toxin, whether it's mold, heavy metal, pesticides, herbicides, plastics. Every day we read in the news about your brain contains a credit card worth of plastics. Your heart plaques
Yeah.
have plastics in them. And if you have plastics in your heart, in the arteries, the plaques in the arteries of the heart, you have a 450% higher risk of having a heart attack in the next 3 years. And 57% of guys have it.
Yeah.
This is a big deal.
This is what really caught my attention because I know I do mold toxicity all the time, and there's still limitations. It takes a long time. And you talked about we've talked together about you, especially MD Lifespan, the top four big players. And I think some of the reason that these are, and you can talk about them in 1 second here, but I think the reason that that's such a big deal is plastics, for example. We don't know a binder that will bind plastics. We don't have a protocol. So talk about the top four things that we're seeing this be especially effective for.
Now, first off, let's paint the field. There are hundreds of thousands of toxins out there, but we can put them in real broad categories. There's about 12 different categories we can put them in. But not every toxin is built the same. I mean, waxes are a toxin, and we're putting wax on all our food, and
Mhm.
we have those waxes in us, and they act as estrogens, and that's a problem. But we have other toxins with us that are much more severe because they break the DNA and they kill
Yes.
the. Those are the ones we call cytotoxic and
Mhm.
carcinogenic. And the top four players are plastics, mold,
Yeah.
pesticides, and forever chemicals, PFAs.
Hmm.
And we know how deadly, do we have literature? We don't need any more evidence. We know any one single one of those is highly lethal. Believe it or not, on average, the healthy American on our studies that we're looking at is out of 100 different toxins that we're testing. And remember, there's 300,000 toxins we could test for, but if 100 toxins we're testing on people, the average healthy person has 13 of those in the high critical range.
Wow.
And we're like, why are we getting sicker? It's
Yeah.
because we have,
And you're talking, I want to emphasize that because that's the average healthy person compared to I'm
right,
seeing the chronically ill patient who probably has
right.
an average of
And they're in the
39.
40s.
Yeah,
They're like
exactly.
40. Now, if you want to think about this, 300,000 toxins in the universe in the United States, we're measuring 100 and you have 13.
Hmm.
Now you have to take that 13 and you have to multiply it by 3,000.
Hmm.
So now you have 39,000 highly critical toxins. So that 13 isn't just 13.
Yeah.
That's just a fraction of the 30,000. So if you want to look at the fraction and say, if I compare that to all 300,000, you're looking at over 30,000 highly critical toxins in each of us that's healthy.
Yeah.
And we're wondering, why are we getting sick?
Right. Why is our immune system not functioning? So to me, this is just a really, that's why I'm so excited to partner with you guys and have this available in my office. But let's talk a little bit about what does this look like for the patient? So say someone is listening, like, I want to know more, Paul. What do they do? And then what would that process look like if they were to be accepted into your protocol?
So everybody needs to learn about toxins. And
Hmm.
the first thing we always say is go get your toxins tested. Remember back in the day before we had the ability to check your blood pressure, we didn't know how dangerous blood
Yeah.
pressure was. Or diabetes. We didn't have a way of measuring glucose until we did. Then we figured out how dangerous it was. Toxins are the same thing. We have the method of testing. You need to go get tested so that it doesn't matter if you feel good.
Right.
Matter of fact, we have a group of women who are 60, they're lean, and they use beauty products. And they have 40s and 50s out of 100 of toxins because
Uh-huh.
of all the products they use,
Yeah.
and you will get into sickness from this. Now,
Yeah.
outside of that, there's people out there with chronic inflammation. They don't know why. Or there's people out there who are chronically ill already. Like we know them, right? The mold patients. But I tell
Mhm.
people all the time, it's not just the mold. You also have the plastics, the pesticides, the PFAs, and all the other toxins too.
Mhm.
So everybody may be leaning one way or the other, but you have to deal with all of them. If you don't deal with all of them at the same time, you won't get better.
Right.
Now, so what's that look like for an individual patient? If you do the testing and you don't have a lot and you don't have inflammation, you probably can do avoidance and you're going to be fine. But if you have a lot or you have inflammation or you already have a disease, you have to go to plasma exchange because there isn't anything that gets all these toxins out.
Yeah.
What the process works is the patient visits with one of our doctors and we explain the whole process. But basically, is the patient comes into our office, we check a blood test, we check a urine test, we weigh them, and then we start an IV in one arm and we start an IV in the other arm. And it's just like a plasma donation. Your blood comes out, it gets
Mhm.
separated. We throw the plasma away, we give you back a replacement fluid, it goes back into your body, and you're there for about 4 hours, of which
Mhm.
about 2 hours is on the machine and exchange. The vast majority of people get up, say hello, goodbye, and then they go home. And then they come back every month and they do it for about a total of 5 different times. Now, our process has been patented because around all this, we wrap the whole program of avoidance. So we're teaching you how to keep them out. Because you're going to spend money to get them out, and it's not an inexpensive process. We're going to teach you how to get them out. Now, we're 3 years down the road, and every patient that followed our avoidance program has not gotten any of their toxins back.
Wow.
And that's a
That's
surprise to us.
impressive.
But it's, but
Paul,
it's,
let's stop there
but it's
just for a second because this is so important when you shared some of the data for conventional plasma exchange versus your patented protocol. There's a pretty big difference. Do you want to just give a few statistics on why that's actually different with what you've developed?
So there's some people out there that are doing plasma exchange to remove toxins, but they're just doing plasma exchange.
Mhm.
Versus our program, which has avoidance protocol around it. It also has IV nutrients,
Yeah.
oral nutrients, selected medications, and what we call orchestrated therapy. Now, all of these things are safe and natural.
Hmm.
So, so everybody's like, if we don't involve any brand name
Yeah.
medication or prescriptions and drugs or anything like that. It's just things that have been around. But the way we put that together has given us a 300% increase over just TP alone.
Wow.
That means if that TP removed one particle, we'll remove three. And when you're paying money, and we'll talk about the pricing, it's not an inexpensive process. You want to get the best bang for your buck for the money. We're the only group that has this because we patented this product. We patented all of our processes because they're that novel.
Yeah. No, and I looked at some of it and it's so impressive because with a functional mind of what you do to actually enhance outcomes, you're thinking of all the right things. It's really powerful. Now, what I love is on your website, you've already developed, I don't know, 8 different protocol sections. Do you want to go through someone listening like brain and heart and go through the different kinds of patients that might benefit from this?
So you got to understand we're all toxic.
Yeah,
We got to start there first.
right.
And then toxins are the cause of inflammation, of chronic inflammation. And it's only toxins that are the cause of chronic inflammation. And chronic inflammation causes everything bad, like cancer and Alzheimer's and heart disease. Now, some of our protocols are just about getting the toxins out because we have people that want to have a toxin-free environment and they want to be toxic-free. They don't have any symptoms, they don't have any inflammation, but rightfully so, they want to get clear. So that's called our MDL toxin protocol, and we're
Perfect.
just removing the toxins. We have moms that want to get their body clear before they get pregnant because we know every baby is born with 270 neurotoxins
Yeah.
in the umbilical cord and plastics in their first stool.
Yeah.
And it's our belief, I'm emphasizing our belief, that most of the spectrum disorders are caused by the toxins interacting with the baby at a crucial stage during development. And if
Yeah.
you get yourself clear, the probability of the baby getting spectrum disorder is much less. Now, we haven't proved that yet. We're actually in the process of getting those studies underway. But that's also kind of a detox protocol. And finally, what made this whole thing quite famous and quite well known is the longevity study that was
Yes.
done by Adobe Kiprop, who
Yeah.
said if you do plasma exchange, you're going to reverse the biomarkers of aging. We do that protocol too. So that's our MDL longevity marker. Now, what we realized is once we had such a phenomenal result on lowering the toxins and we reduced the inflammation, reduced the oxidation, reduced the cancer markers, and the immune system got better, we said, I bet you now we can start using some of those therapies that we always known would work with chronic inflammatory
Yeah.
diseases like heart disease,
Right.
Alzheimer's, Parkinson's,
Yeah.
cancer. And we developed protocols to aim specifically at that. So we have done dozens and dozens of people. It's all observational. You can read
Yeah.
about it on our website. You can watch testimonials. But we've been able to reverse people's memory. So you just have to see the testimonials online to see their story. They're up by 17 to 40%.
Wow.
These people are basically back to where they were before they started becoming forgetful.
Mm.
We have patients who have like where they've had cancer and they don't want to get it again,
Mhm.
or they have cancer that we're doing what's called watchful waiting, like prostate cancer.
Yeah.
And we have a testimony of one of the guys, we did the protocol on that. We reduced his inflammation and his toxin levels so low that his prostate shrunk by 25%. And
Wow.
all the markings that we would see on the MRI disappeared that were associated with cancer. We know he still has it there.
Yeah.
It's not visible from
Right.
where, because this goes back to the whole idea that cancer is caused by a toxic microenvironment, and we just fix the microenvironment.
Yeah. Yeah.
So it just gets really exciting. And now we have patients with heart disease, and what we're seeing is markedly reducing the oxidation and the inflammation around what is the major cause of heart disease, slows down the progression of the plaque development. Matter of fact, in some of the patients, we're seeing up to 17% of plaque reversal just with
Yeah.
this protocol.
That's what it's so amazing because it
All the
really,
toxins,
right?
it's all the inflammation.
And of course, it's going to work for almost all of these chronic complex conditions because at the core, as we first established, toxic load is really the core. And I love to frame it as far as functional medicine. I always think of toxic load, infectious burden. So you have this reactivation of old Lyme disease or Epstein-Barr, but all of that often comes from toxic load suppressing immunity. And for
100%.
mold, for example, we have mycophenolic acid, which is such a known immunosuppressive used to make the drug CellCept. So this
Yeah.
concept really does bear out in science that if you pull that toxic load, and even with heart disease, it makes, I just want to clarify because people are like, how does this work with heart disease? You said it so well, but the truth is it's not, cholesterol's innocent. It's spackling on the
It's
wall,
the
like you said.
inflammation effect on
Yes,
cholesterol
yes.
makes it a bad player,
It's
or
the
the
oxidate,
oxidation
right,
effect on the cholesterol that makes it. The cholesterol is just an innocent
right.
bystander that gets affected by the inflammation and oxidation, which turns it into a damaging particle.
Yeah.
Once you remove the inflammation and oxidation on all of our heart patients, the particles go down and the
Mhm.
small dense particles disappear.
Yeah.
The one of the most one of the most commonly prescribed protocols that we use is the immunity protocol.
Hmm.
That's where you and I talk so
Yeah.
much because that is exactly what you're talking about. That is when the immune system has been affected by the toxins,
Yes.
and the infections I consider to be just another sort of
Right.
toxin. But you can't get rid of the infections when your toxins are suppressing your immune system. It's
Exactly.
just not possible. Antibiotics work by augmenting what your immune system can do. Without an immune system, antibiotics don't work.
Yeah, that's really the key is like you often take off that load and the body functions just fine because most of these are very low virulence, meaning they're not going to kill a person. They're just active because their dormancy got exploded because of the weakened immune system. So
Right.
I really love talking about that. And we're developing a new mold protocol, which I get so excited
Yeah.
about. So stay tuned because we will have all the data on that on a very specific protocol for patients who have mold toxicity, which you and I agree is probably one of the most tough, difficult types of cases that
It is amazing that the United States government does not pay more attention to mold toxicity when everybody else in the world does.
right.
They all list it as a high. I mean, we have some of the top toxicologists in the U.S. that are partnered with us, and I tell you every day of the week, they're very concerned about the
Yeah.
mold toxin. I mean, whether you're looking at any of the toxins or whether you're looking at
Mhm.
any of the MPO or even ochratoxin, they're
Yeah.
just these are highly cytotoxic. That mean they kill the cells.
Mhm.
They're highly immunosuppressive, and they really do suppress the immune system. As you said, MPO is made into a chemotherapy drug.
Yeah. So patients are getting tested, obviously toxic load is. Are you doing baseline of inflammatory markers like CRP or lipid peroxides or some other things there?
We do baseline testing of a lot.
Yeah.
We do 109 different toxins,
Perfect.
and then we do the whole immune system. So we're looking at your lymphocytes,
Yeah.
not just your CBC and your white cell. We're
Right.
looking at your lymphocyte count, your CD3, your CD4, your CD8, your CD57, your CD19. We're looking at the IgG ratios of all
Yeah.
the different types of IgGs and what quantitative you're doing. We're looking at all the inflammatory markers. We look at all the oxidative markers. We're looking at all the interleukin numbers,
Yeah.
the necrosis factors, the TGF beta ones.
Mhm.
We're looking at all of these things at the immune system because that's the system that you
Yeah,
see impacted the first
right.
and the worst, and it's the last one that gets better in the toxic load. So even if people don't have a lot of toxins, the reason we want to do the immune system is because for that person, because it's the toxins that you have playing against the DNA that you have.
Yes.
If you have DNA that's not really great for immune system and you have the toxins, your immune system's going to crash. And when your immune system crashes, that opens the door to all these chronic infections and heart disease and autoimmunity and cancer.
Hey guys, just a quick break to remind you, please subscribe on YouTube if you haven't already. We know a lot of you listen and don't subscribe, and that's quite all right. But I want to thank those of you who are subscribers. You help us to reach more people, invite better guests, and to just bring you all around great quality information. Please also pop in the comments, leave me some feedback, questions, comments, things you want to hear about. I do read those comments and respond personally. So look forward to seeing you right after this. Yeah. No, I couldn't agree more. And really, that's where it lies, that infectious toxin and where it interplays immune system inflammation, which is why any inflammatory or immune dysfunction, you're seeing results because you're going to the root cause. Um,
We've had patients that had chronic infections for 20 years
yeah,
that after they did the protocol, we were able to clear out their chronic infection because their immune system woke up
yeah,
and got to work. And then we were able to use the immune system with and the things that we tell doctors all the time. MD Lifespan, we just specialize in doing TPE. We don't do chronic care like you do.
yeah.
We don't do chronic, but we take your patients, we get them clean. Now we can return them to you so that you can use the protocols that you know should have worked but they didn't because the toxins were suppressing the immune system too impactfully.
So this is great. And let's just pause for a second because there's a lot of doctors who listen to Resiliency Radio, and I want to talk to them because they can refer and there's no competing clause here because you're kind of doing this thing and sending them back for how would a doctor do referral? Would they just send a patient to your website?
They can simply send the patient to our website and the patient can schedule a call. It's right on the front
Yep.
page.
Okay.
That call, the patient will meet with our doctor on the first call.
Mhm.
The patient can bring their doctor with them. We can make a three-way call if the doctor wants to join us for that call as well.
Right.
If that's a kind of introduction call, so we making sure the patient isn't eliminated from TPE. We might make sure they're a candidate for TPE and make sure that they fit into one of our protocols. If they do, we move them for an evaluation phase by our doctor, in which the patient's looking at their labs. We're looking at their labs. We're looking at a questionnaire. They're looking at our consent. Their doctor can also join us for that call as well, as we discuss all the different protocols and how we would put them together. We customize the protocol around the patient. Here's something very important that makes MD Lifespan different than a lot of the other companies doing this. We are a public benefit corporation. All the doctors that we work with specifically made it this way so that our purpose is try to drive this to every patient that needs it.
Hmm.
And we've done a lot of different things that other people haven't. We've realized that it's not how quickly you do the TPEs, it's how many you do. And you
Yeah.
can space them 3 months, six
Hmm.
months apart, and you will still get the benefit. It'll just take you longer, but sometimes from the financial burden, that's the way
Yeah.
the patient needs to do it. We also do the financing in-house. So we don't require people to pay us all the money up front. We pay half up front, then they can pay the rest off over the next 90 days. We're very dedicated with trying to do whatever we can because plasma exchange offers something that hasn't been available to the field for people who have mold toxicity or many of these inflammatory diseases that are caused by toxins, which we're now able to give them at a local
Yeah.
office.
That's so exciting. We'll talk just briefly about price. I want to talk about too, I think you mentioned this. I just want to be clear. If someone's like, do I do a consult? Do I have to pay for that? It's free to talk to your doctor, right? And I think the first two visits are until they get accepted in the program.
All the visits are free
Yeah.
up to they purchase a package. And
Yeah.
then everything you need is in the package. All the labs, all the visits, all the medicines, all the TPEs. It's just one price. We just try to make it
Yeah.
easy for people to understand that this is the price. And we've substantially, if you added up all these individual items, it's substantial. It's usually 30 to 40% more than it would be, but we're making these package prices for people.
Yeah, I think you've done a really good job of trying to make it affordable. And obviously, you and I both have a goal to get this widespread covered someday by insurance,
Oh,
which is
we
why
will. They'll
you're.
have to. I
Yeah,
mean,
yeah,
what we're going to see, if you want to look forward about 5 or 6 years, what we're going to see is traditional medicine. This will belong in every cardiologist office, every neurology office, every rheumatologist office,
yeah,
every gynecology office, every obstetrics office, because every field in medicine is impacted by these toxins,
yeah,
and it's only getting worse. So
yeah.
it's not like this problem's going to go away tomorrow. But what we're going to start seeing is the government will start paying for this procedure for the worst of the worst.
Hmm. Yeah.
That's typically how it works in
Yeah.
medicine. They won't pay it for everybody, although everybody probably needs it, and they
Right.
won't preventatively, like we need to do it now
Yeah.
instead of they will do it for the people who are starting to develop Alzheimer's, who have heart disease, and we're trying to not do bypass surgery.
Right.
So this is how we know. I'm just being a realist. Everybody's like, I wish it wasn't that way. I do too. But in the realist, we can get this into medicine.
Yeah.
We need to get this into medicine. We need to get at least to start where the worst of the worst are getting this therapy because there is nothing else that comes close to what this does.
Dr. Savage, that's why I get so excited because I've been in toxicology, basically environmental toxicology for 2 decades, a little bit more, and I am seeing the writing on the wall with the typical oral stuff for liver or glutathione is not working anymore, especially for plastics and PFAs, which are forever chemicals. So this is huge. So the talk just briefly, one thing I noticed in your protocols that I think is so powerful is you have the sequential therapy, right? Every 1 month, 2 month, 3 month, 4 month, most protocols are 3 to 5 months, some go longer. What are kind of the average cost of those different sessions? And maybe just give us a kind of range. People can get more information when they do
Sure.
the consult. But
The average TPE, just TPE by itself, if you were to look across the United States, is the lowest you're going to find is I found 4,500, and more commonly it's about 10,000.
Mhm.
At MD Lifespan, we're at 6,000. But I always tell people we have highly trained nurses. We have the experience. This is all we do. We're the expert at it. And we've lowered the price as much as we can to stay in business.
Yeah.
And we're just trying to get these out to people to do it. If you want to go someone that does charges 4,500 and they might do 3 or 4 of these a month, or maybe less, and they don't have a nurse that's dedicated to this and a company, then that's your choice. You can do so. But you're going to get the quality and the experience for the price that we have there. But then we can add everything in. And when
Yeah.
we start adding in labs, and we're talking about hundreds of labs, medications, supplements, avoidance therapy, we have a software program that teaches you
IVs.
what you need to
Mhm.
know along the way. We're looking at prices of the toxin that runs about 20,000 all the way up to the immunity one and the heart and the brain, which can be 40 or even 50,000 total. Now, I
But that's
understand
like 5 months or more of the
that's like
everything
6 months, and
included, right? Yeah. Yeah.
everything is included.
Yeah.
So that even with the brain protocol and the immunity programs, which is two of our more
Yeah.
expensive ones, even there's a lot of companies that those include 5 TPs. A lot of
Yeah.
companies $50,000 just for five
Right.
TPEs. And
Right.
our protocol has stem cells and exosomes, and it has supplements, and it has testing, and it has all the doctor visits. Because some of these people, they don't give you doctor visit; they just approve you for a TPE. You come get a TPE like you're getting an outpatient IV. You just go get
Right.
an
Right.
IV and then you go home. That's not what we do.
Yeah, and I really like because we're comparing apples to apples. If you just want to go out and Google TPE and find prices, you're not getting, you guys are doing true preventative, regenerative, functional, personalized medicine with a full protocol, which I love.
We have the data,
Yeah,
we have the
yeah,
studies, we have the patents,
yeah,
we have the doctors.
yeah.
I mean, we have 27 medical advisors from all across the United States, from the top cardiologist to the top neurologist to the top toxicologist, all being our medical advisors. We have a purpose here.
Yeah.
All of the doctors I'm working with, most of us are near retirement or were retired. They're very well known in their field, like you, having come in to work with us. And we're taking all this aggregate data and just pointing it towards this one huge problem that we all face,
Yes,
which
yes.
is toxic overload.
Right. Yeah, I get so excited. So a few little final questions is one thing I like that you do is you use albumin versus frozen plasma, and I think you're getting less side effects. So I guess two questions. Number one, why is that? Tell me the difference there. And then second, is there contraindications or people that you would feel that you would say this isn't right for you?
Sure. So that when you Google therapeutic plasma exchange, you need to be careful because you have to ask yourself, what are you exchanging the
Mhm.
plasma for?
Yes.
And we're using albumin, which is a very benign, neutral replacement fluid. It does come from from plasma donations, but what they do is the process by which they acquire the albumin out of this eliminates everything, including the spike proteins, viruses, cancer. It's been around for 50 years. It's so commercialized that the government doesn't even count it as a transfusion product at this point. So we want to use that because it's clean. And people are like, how do you know it's clean? Even through the HIV era, which we were doing TPEs, nobody got HIV from a TPE from using albumin. It just didn't happen. This is how clean that product is. Versus plasma. Plasma is somebody else's blood fluid, and they're giving you You have a lot of stuff in there that are nutrients, that are hormones, especially if it comes from a younger person, but you don't know it's from a younger person. And even if you know it's from a younger person, you don't know how toxic that plasma is because everybody's toxic. So you're replacing one, you're taking out toxic, putting in toxic, but you also start having this risk of transfusion reactions. Out of the last 300 procedure we had three minor events where two people got low lightheaded and one person passed out because their sugar got too low because they told us they ate and they didn't. Versus plasma exchange with plasma, you're going to have 26% of the people having side effects, including anaphylaxis. That means that reaction, that severe allergic reaction where you can your throat swells up, and then also what's called transfusion-related acute injuries, like to the lung. That occurs, and you never know who it's going to occur on, but it comes from doing plasma. So you don't want to do plasma donations with therapeutic plasma stage unless you're in a hospital and your back is up against the wall and you need those special things that are in this. But if you're looking to do it for longevity or to reboot your immune system or to do what we're doing, don't even consider using the plasma because as an old ER doctor, when people with traumas would come in, as I'm hanging the 10th unit of fresh frozen plasma, by the way, you're getting 10 units when you do plasma exchange with plasma. I would wonder, is the trauma going to kill this person or is that plasma exchange going to kill them because the plasma transfusion reactions like idiopathic purpura, and then the injury to all these various tissues, it's a real thing. So please, if you walk away from anything from this conversation, hear me say two things. Go get your toxins tested. You can do that at our website or with Dr. Carnahan because you don't know what you got until you test. Number two, never get the plasma exchange with plasma. Only get it with albumin, wherever you want to get it, but only with albumin. Your doctor is taking a risk with your life that you don't need to do for these kind of procedures.
Dr. Savage, it is so exciting to hear about this because I believe, like I said, with my realm of expertise, this is really the next step
Yeah.
for people who are super toxic and even those who just want optimal performance, optimal brain function, optimal heart function. There's nothing else out there like that. If people want to know more, where is your website? And just mention again how they can find you, what the next steps would be.
So our website is MD Lifespan.
Mhm.
And on our front page, you can schedule a call to talk to one of the doctors, no charge, or you can actually sign up to get your own toxin testing. And when the results come back, you'll still talk to one of our doctors so we can tell you what it means for you. And again, there's no charge for that doctor visit or that doctor charge for interpreting your lab. We just want to provide you with the best information. Our website also has all the guidebooks to help you learn how to avoid the all the toxins in your universe, and it's really not as hard as you want to make it think. And with Dr. Carnahan here, we're going to soon be having another one just dedicated to mold because mold people out there are special people that need just more guidance because mold's just a terrible thing for people to have.
I am so excited about that. So thank you, Dr. Savage, for your work. Thank you for basically, I mean, you've done a lot of work. You wouldn't have had to come out and do this. And yet I feel like your whole life has kind of led you to this place to make a difference.
I had to come back. I had to come out of retirement to do this because when the universe gives you a gift and it says,
Right.
"Here, this is how you fix all this stuff," and it's the major issue that it's facing everybody today,
Right.
and it's going to become more and more in the news. And if you're listening to this today, imagine a year from now because it's just going to be
Yeah.
10 times worse. We have to stop polluting the government, stop polluting the environment. But before that, you can stop polluting yourself. It's not that difficult.
Love it. Well, thank you again, Dr. Savage, for your great information. Well, I hope you enjoyed that episode with Dr. Paul Savage. He is a wealth of knowledge, and I couldn't be more proud to be helping with MD Lifespan and helping to create protocols for mold toxicity, which we all know is increasing in incidence and such a difficult thing to treat and to deal with. So, super excited about MD Lifespan. I hope if you're interested, you'll go there and just order that toxin test and get started, at least find out your toxic load. And if it's elevated, make a call with the doctors. It's all free to start. Just check it out if you're interested in learning more. Like I said, you can start MD Lifespan, go there, get a toxin test, and then schedule a consult with their doctor. Thanks again, guys, for joining me for another episode. As you know, we have new episodes out every single week. Please, if you haven't yet stopped by, leave us a review wherever you listen to podcasts on Spotify, iTunes, or anywhere else. And hey guys, if you're on YouTube here, would you please subscribe? We know many of you guys listen and you don't subscribe, and that's okay, but it really helps us to reach more people. If you hit that subscribe button, hit the bell to be notified of new episodes, and I will see you again next week.